Hello, class, and welcome to week 4. I wanted to take the time out to wish everybody a happy Labor Day and hope you had a great holiday weekend and enjoyed your family and friends. I want to take a step back and just kind of review our last discussion board 3, around your service learning projects. Many of you chose to do some community service with some of the Meals on Wheels or food banks, which are very much needed areas in the community, feeding the disabled, those who are without resources, and a lot of you mentioned the elderly population. In reading your post, I must say that it was very good collaborative discussion around your passion in serving these communities and also thinking beyond the acute episode of care and how we as healthcare providers or providers of care can assist our patients as they transition back into their communities. One of the things was mentioned was transportation. We talked about medication adherence. How can a patient pay for their medications when they're worried about having food or having their lights on, or if they do not have transportation to go get their medications, or they do not have insurance. So these are a lot of barriers, disparities to our populations. So again, how do we as healthcare providers assist our patients beyond the acute episode of care? How do we partner with the community resources to assist in making sure our patients are adherent with their medications by providing resources to get them or assist them with the cost of their medications? Transportation, follow-up to their appointments. What are the social barriers to these vulnerable populations? What kind of caregiver support do they have? What is their understanding of their own healthcare status, their health literacy level, and the literacy of their support at home? Understanding how to eat the foods they love but prepare them in a different way. Or for a household that cannot afford to buy separate food, how do we ensure that they are able to educate their family and come together and find food that everyone can eat that is healthy for that patient as well? So just wanted to touch base on that. I really look forward to reading more about your learning opportunities once they're complete. I think you all have a great desire and passion to be servant leaders in your community. So as we move on to week 4, we're going to continue working in module 2 on vulnerable populations, and we'll be focusing this week on health promotion. So our discussion board number 4 is around your health promotion projects. So the World Health Organization recognizes health promotion as a process of empowering others to take charge of managing and improving their own health. This includes not only just the individuals, but their families, the community, the providers of care, the healthcare team, and working together collaboratively towards the goal of achieving optimal health. Health promotion focuses not on the individuals, but their families and support at home. In your textbook, Chapter 6 of Anderson and McFarlane, it tells us that there are 3 essential health promotion topics. This includes encouraging change in behaviors around prevention and wellness of disease management and how to manage these behaviors. Encouraging behaviors that will inhibit behaviors that are harmful to one's health. So encouraging ways to promote healthier behaviors and positive thinkings that will steer them away from doing activities that is harmful to their current health. And if they're healthy, let's keep them healthy. If they have reached beyond their state of current health, how do we manage where they are? In your course syllabus, you will find a link to the healthypeople.gov. I urge you to please take the time to review the Healthy People 2020 Leading Health Initiatives, which are around access to health services, clinical preventative services, focus on age-appropriate screenings, targeting conditions, for example, diabetes, or patients with high levels of hemoglobin A1C greater than 9%. How do we control or manage that patient population? How do we get them to a state that do not progress and their diabetes may get worse? Also, the environment and the quality of the environment. Injury, health, violence, mental health. Mental health is a big factor in our populations and communities today. The access to limited health resources are minimum, or the wait time to see mental health providers sometimes is a barrier to care and a barrier to mental healthiness. Maternal, infant, and child health initiatives, vaccinations, healthy pregnancies, healthy babies and children, obesity, physical activity and nutrition, oral health, sexual health, and other social determinants. Also, substance abuse and the use of tobacco, smoking cessation. Just a reminder, so for week 4, your discussion board post will be under module 2, and what you would do is there will be a link in discussion board 4 for you to watch a video, and this video will be of the previous students in their mission trip to Haiti. The video is narrated by one of our faculty members, Kathy Fall, and it is my goal that you look at this video, look at the different pictures that you will see, look at that great work being done with those people in Haiti and how they are so appreciated and welcoming of someone willing to help. Think about this as you're doing your health promotion project. If you were there and you are the teacher and you're trying to explain your topic to the people and how much of a great impact this would make. Please look at your course calendars and make sure that your assignments will be turned in on the due dates. And as usual, if you have any discussions, any questions or concerns, please feel free to reach out to me. You may ask me a question under the Ask the Faculty tab in Blackboard, or you may email me directly. Thank you, and I hope you all have a great week.